Hi, this is Ross Miller at Sonitus Medical. This presentation is called SoundBite ITM Tips and Techniques, and this presentation is for anyone adjusting an ITM in the mouth part of the SoundBite hearing system. The topics today, expectations on the audiological side, patient side, setting the right expectations at the time of fitting, how to fit and adjust the ITM, what the components of the ITM are, why the ITM may need adjusting, where to adjust it, and some techniques for adjusting, bending the wire and adjusting the acrylic. And now this presentation is the very basics on how to adjust the ITM, and anything further than these minor adjustments on here, more than likely you want to talk to your partner dentist about and have them do it, or have them show you how to do it. Expectations. Well, the ITM obviously goes in the mouth. I mean, it's basically like a small partial denture or a retainer. It isn't dentist. This isn't dentistry. It's simple stuff. There should be no occlusion on the device in most cases, and a very simple adjusting as needed. But the mouth is a very sensitive area, and patients can feel things quite differently. And patients' expectations are different. I would recommend that you show confidence when you're placing this in the mouth. Patients will know, you got to listen to the patient. These patients have been cleared by the dentist, so you know that their dentistry is just fine. And the patient should have normal dental anatomy and restorations. Everything should be healthy in there. And everything new here is a learning opportunity for those involved with the SoundBite hearing device. It's exciting to learn new things, get to know the mouth a little bit. This is unlike any other product out there for hearing, and smiles are beautiful. I mean, it's nice to have a device that goes on the teeth. We in dentistry are very excited about the SoundBite hearing system because now dentists can be, a partner in helping their patients hear better. First of all, the patient is used to nothing in the mouth. Okay, the patient, the ITM will always be more uncomfortable than nothing, and that's sort of an unfair comparison. So when placing the ITM in the mouth, you need to talk to the patient. Yeah, this is going to be like a partial denture or a retainer. Expect that it's going to fill up some space in your mouth where the tongue normally is and where the cheeks normally are. And it takes time to get used to the ITM. It may take two weeks to a month to get used to it. There's two considerations here: the comfort and the hearing. The ITM has to be comfortable in order for for the patient to get the proper hearing aspect out of the ITM and the BTE, out of the SoundBite system. So it's got to be comfortable, and they generally are very comfortable. So we need to make sure that they're, in the mouth and the patient's happy with the way they're fitting. And there's lots of reasons why a device fits nice or doesn't fit nice. There's a lot of anatomy issues that I won't go into here, but 99% of the time it should fit just fine around the teeth. Chewing, start patients first with soft foods, yogurt or soup, then try harder foods, baby steps. Take time to get chew with these. Some patients can do it quite nicely. Other patients have a hard time. Speech really should not be affected, although occasionally somebody has they say that their speech is a little bit different, and it takes time. Sometimes coach the patient into chatting with one of their close friends, and they can usually get over this. The possibility of any changes in speech. The way the patients hear their voices may be different. The ITM is made out of plastic and affects the way that the sounds vibrate through the skull and the way the patient hears their own voice. The ITMs fit between the teeth, the palate, the tongue, and the cheeks, so they need to be comfortable on all those areas. They need to be smooth. They need to not interfere with tongue function, and they not bang up into the cheeks. Generally, when I place an ITM in the mouth, I coach the patient. I show them on the model. It's important to have the model there, the plastic model that SoundBite, that Sonitus gave the office, and show how that fits on and off the the model. Let the patient put the ITM in the mouth. Should take about 15 seconds or so. Should fit comfortably. The mistakes that I've seen patients make is sometimes putting the device on the back, one tooth farther back. That sometimes might make the patient gag a little bit. So if the patient's gagging, it's probably one tooth too far back. But generally, they go in pretty quickly, and they just pretty much snap into place. And depending on the tooth anatomy. Now, the ITM is very much dependent on the anatomy of the teeth. Some people have very, very retentive anatomy, and some people don't have retentive anatomy. And those are the variations that we see when we're fitting the device. What is the range of normal? Dental anatomy varies from patient to patient. Patient's attitude toward treatment varies greatly. So some people, some people adapt to things quickly. Some people have a hard time adapting to things. And some people never adapt to things. So you need to kind of check and see what kind of patients you have there. Patients that are very positive about things, that can manage adapting to new things, will have an easier time. One of the things I ask patients when they're getting a new device is like, how hard is it for you to find a pair of shoes that fit? If a patient has a very hard time finding a pair of shoes or glasses, they have to go through 100 sets of shoes to find one that fits. Well, more than likely the patient's going to have a very, very difficult time with anything new in the mouth. So a lot of it, the way the patient perceives things is huge in this. The ITMs will always move in the mouth a little bit. I mean, you can always rock them a little bit with your fingers. Some rock more than others, and that's very much dependent on the anatomy of the teeth. So coach the patient in that this is pretty normal. The tongue can remove these sometimes. The tongue's a very strong muscular organ that's in the mouth, and it can move these. It can actually remove them. So don't be surprised by that. Real expectations are very important. This is you've got to compare what SoundBite is to other options such as surgery and that sort of thing. So realistic expectations are very important. And the musculature of the patient varies from patient to patient. If the patient opens their mouth very wide and they touch the ITM, well, just coach the patient. Maybe you don't want to open that wide because there's a part of the mandible called the coronoid process that comes down and may try to dislodge or slightly touch the actuator of the ITM. So and excursive movements left and right of the lower jaw can sometimes patients find that they can feel the ITM a little bit more. But you just coach the patient that just don't try to avoid these unusual variations in jaw movement. I mean, normal jaw movement, it should fit just fine. So the initial placement of the ITM. Again, the anatomy of the teeth in the undercut's important, how it fits. Rinse it in some mouthwash to freshen it up in your office. Have the patient rest the thumbs on the buccal and lingual portions of the ITM. That's the battery side and the actuator side. And you place it on the teeth. It should snap nicely depending on the tooth anatomy. But it should just fit right up there. Here are the components of the ITM. We'll go clockwise on this, starting in the upper left. The actuator produces the sound. Oh, I'm sorry, counterclockwise. Actuator produces sound. It's the part that is on the cheek side of the teeth. We call the nub. The nub is the only part that should be touching the teeth. It should touch two teeth and vibrate through those teeth. The battery powers the ITM. There's a palatal acrylic for retention, and then the hypotube connector. This is the connector that there's a wire that there's electronics that go from the battery to the actuator, and so this is not a wire. This is a tube, and we call it the hypotube. But a lot of times, it looks like a wire, but it actually has wire. It's actually a tube with the wires inside of it. So here's how the actuator should fit on the cheek side of the teeth, on the buccal side. The actuator should touch both teeth, and it should rest very comfortably right above the gums and right below the height of contour of the teeth. From the front, the actuator should touch both mesial and distal teeth. That's the front and back tooth, but only the nub. Here's some shots of the actuator in a patient's mouth, and you see how it sits right above the gums between the two teeth, and it vibrates imperceptibly through those teeth, creating a bone conduction sound. So it should fit in these embrasures and undercuts of the teeth. Again, dental anatomy varies from patient to patient. If you have a patient with, and we'll get into that in a second, but there are variations that make the ITM less fitting less on some people and other people just great. So we need to be aware of those things. Why might the ITM not fit? Well, the patient might bite on the wire or plastic. Patient's occlusion varies from patient to patient. We design this to be out of occlusion, and we take impressions of the upper arch only, like we would be doing for a retainer on a patient. We generally don't take lower impressions for retainers in dentistry. But there are times when you will have to take a lower impression, especially when they have cross bites or unusual variations in tooth anatomy that you may see the lower teeth hitting the upper teeth. The patient may say they are too loose. The patient may say they are too tight. Might be a little sharp to tissue of the tongue. Might feel strange, new or different. Anticipating and avoiding possible denture sore-like problems is also important with these. Sometimes, if a patient really likes the SoundBite hearing system, they may wear it all the time. This will sometimes create little sores in the mouth, and those little sores are very easily managed. Just have the patient take a break from the SoundBite and rinse the mouth with warm salt water until the sores go away. But these are what we call denture sores in dentistry. I mean, they're common manifestations that occur in the mouth when you're wearing something over soft tissues around the teeth. Now let's talk a little bit about the adjusting these devices. Well, you might have to loosen or tighten these devices, and you want to use a three-prong plier on the wire to adjust or tighten or loosen. Sometimes you might have to adjust the acrylic. You see a little red spot on that acrylic. That's done with articulating paper. And anticipating and avoiding possible denture sore-like problems. Like if a patient really likes it, if they're like really excited about the product, more than likely going to wear it a lot, that's a patient that might have a denture sore. Coach them on taking the device out, rinsing them out with warm salt water, and just the fact that you anticipated that will make the patient much more comfortable. Make the patient feel more comfortable with SoundBite. Just talk to them about the possible things that they can expect. It's going to take time to get used to it. And then sometimes you might have to move the actuator occlusal or gingerly. This is something you might want to get your partner dentist to help with or get a little more coaching with. That's outside the scope of this presentation. Where to adjust. You can't adjust. You cannot grind on the actuator. Do not try to adjust the actuator in any way, and you can't adjust the battery. Basically, the gray parts that you see here on the photo of the ITM. You can't adjust those with an acrylic burr. You can adjust the hypotube, and you can adjust the palatal acrylic, the clear acrylic, which is basically orthodontic acrylic up by the teeth. That's where you sometimes see the patient biting on it. It's a very simple thing to correct. And then the hypotube is a very simple thing to bend to get, but be very careful bending that hypotube because you can damage it. We use three-prong pliers for bending that. It's great for tightening. Try to be symmetrical when you're doing it. See how in the middle photo here see how the pliers are held up almost 90 degrees to the plane of the wire. And it's simple denture or retainer type adjustments. Always start with minor adjustments first and test fit in the mouth. Sometimes a patient will come in and say, I need an adjustment, and you can do just the slightest adjustment, and that's good enough. Being overzealous with these pliers can damage the ITM, and we don't want to do that. Just do a very slight bend. If you need to tighten it, just a very slight tightening works best. Check the bite. If a patient says they're biting on it, we use AccuFilm 2, and you just basically have them. This is just basically carbon paper. You have the patient bite on it, tap tap tap, grind around on where they're hitting it, and then you adjust it with an acrylic burr. I use in a Dremel. It's simple stuff, and or slow speed, and just adjust it, and then use maybe a rubber point to polish it up. All of these things that we adjust, these are available through your local dental suppliers, and in anything you want, contact your sales team, and they can help you get some of these things. So in summary, set the patient expectations correctly. The ITM will be similar in comfort to a retainer or partial denture, may affect the speech or the way the patient perceives their own speech. Always more comfortable than nothing, however, more comfortable than surgery and other possible treatments. Anticipate and avoid possible denture sore-like problems. Just if you have a patient that really likes it, tell them that they may have to take it out of their mouth occasionally, and because these are the patients that might have denture sores. Make the patient feel more comfortable. SoundBite. You know, baby steps. Go slow at first. If you're, for eating soft foods, for yogurt, soup, that sort of thing. Often the patient will have one favorite ITM. There are minute differences in the ITM, and we're trying to make them almost exactly the same in our lab. But these are custom-made devices, and there will be small, minute differences between the two. And we're working on getting them almost exactly the same. Simple denture or retainer type adjustments with pliers and acrylic burrs. Avoid cracking the acrylic. If we don't want any saliva leakage into these, so you don't want to crack that acrylic. Avoid crimping the tube. Avoid overzealous bending of the hypotube there. There's electronics in that tube, so we don't want to break that. Squeeze with the three-prong pliers as you feel forces, especially with your thumb and fingers. Always keep your thumb and your finger on the outside of the ITM and squeeze just barely. After a few months of wear, ITM may require some adjusted because that wire may loosen up a little bit. Make sure that the dentition is healthy through routine dental care. That's critical. Patients do break teeth, fillings break, gums change over time. We want to make sure that these patients are followed very closely by their dentist. It's okay to get help from your partner dentist if you got any questions. If there's anything that you're not comfortable with, get your partner dentist involved. This is a product that spans dentistry, audiology, and the ear, nose, and throat physician. So it's important that all three of those people work together on making sure that the patient is comfortable and happy with this. Good luck, and thanks for listening to this presentation. Have a great day.